Sakit bhai, good morning.
Good morning, Dr. Saab.
Are available. So
Okay, all your team is there?
Yeah, all the team members would be there, sir.
Okay.
Please put down your cameras so that we can take your snap also. Aishwarya, Jugdan, Abdul Khan, Akshay.
Shakir sir, good morning.
Yeah, good morning, Pawar, Dr. Pawar.
And those who are joined with that number, please write your name because we cannot identify. Dr. Venkat, good morning. Snap, Geshul. Venkat, I think you are you are mute. Just unmute.
Good morning.
How are you?
Fine. Thank you, doctor.
Good morning, sir.
Morning.
Good morning to everyone.
Good morning, sir.
I think most of the industry people are also there.
Morning to
Yeah,
everyone.
good morning.
yeah,
Morning.
good morning. Good morning.
Yeah.
Once again, a very warm good morning to you all. So let's start the today's session. So today, on second day, we have two speakers. First speaker, Dr. Simone Pritchard, Associate Professor, School of Public Health and Zoonosis, Kadwasu, Ludhiana, Punjab. She will talk on importance of conducting scientific anti-mortem inspection in production of hygienic meat. And today we have another speaker, Dr. N.V. Kurkure, Director of Research, Maharashtra Animal and Fisheries Sciences University, Nagpur. And sir will talk on post-mortem examination, importance of examination of lymph nodes in meat inspection. So now I request Dr. Jhende sir to brief about the introduction of today's first speaker. Dr. Jhende sir, please.
Okay, thank you, Dr. Vaidya. Good morning to everyone. So this is second day of our training program on advances in quality assurance and hygienic meat production. Today we have two eminent speakers who will be talking on the anti-mortem and post-mortem examination of animals. This is very important aspect in any food production system. Okay, so unless we provide the healthy animals for the slaughter, okay, we cannot produce the healthy meat. So the anti-mortem has to be done in order to check the animals whether they are healthy or not, and then we have to segregate, and healthy animals are offered for the slaughter for the production of hygienic meat. So on the anti-mortem examination, Dr. Simone Pritchard, she will be talking on this topic. So she is associate professor at Center for One Health, Guru Angad Dev Veterinary and Animal Sciences University, Ludhiana. And she has a very good academic record. She is a gold medalist at her graduation and the post-graduation level. And she did also PhD in subject of the veterinary public health from the IVRI Bareilly. She is involved in UG, PG and the PhD degree program teaching and the research and extension activities of the department at Gadwasu, Ludhiana. She is having about 15 years of the teaching experience. Her area of research interest is the promotion of food safety through detection and molecular characterization of the bacterial and the viral foodborne zoonosis pathogens, and also the application of microbial and the chemical source tracking tools for the water quality assessment. She has received many awards. To name some of these, number one is the University Gold Medalist Award and the Merit Certificate in the BBC in her graduation level, and also the Best Student Award and the Gold Medal Award in 2006 for her master's degree program from the IVRI Bareilly. She also received Dr. V.N. Bachel Young Scientist Award in the 2006 for research work on listeriosis. She is honored with also the associate membership of the National Academy of the Veterinary Science India in 2019. She also received the merit scholarship for the academic excellence during 1999 to 2004 by Punjab Agriculture University, Ludhiana. She was also the junior research fellow and the senior research fellow from 2004 to 2008, awarded by the IVRI Izatnagar for her master's degree program. A Young Scientist Award, travel grants also she received from CSIR to present paper in the 16th International Symposium on the problems of the listeriosis in 2007 in Georgia, USA. She is also the recipient of the Young Scientist Travel Grants by the DST, Department of Science and Technology, to present paper in the International Conference on the Listeriosis. She is also received the Dr. S.P. Singh Best Paper Award in 2013, conferred by the Indian Association of Veterinary Public Health Specialists. And she is also received many best paper presentation awards in various national and international symposium. So so far she has also guided as a major guide for the PhD student, that is 2 PhD student and 12 master degree student. So we have a very brilliant speaker today for the delivering the talk on the importance of the conducting scientific anti-mortem inspection in production of the hygienic meat. So I invite Dr. Simranpreet Kaur to present her topic. Simranpreet Kaur, please.
Thank you so much, sir, for this nice introduction. So I will like to share my screen first. So it's visible?
Visible.
Yes, it's visible, madam.
You can maximize. You can just.
So thank you so much, Dr. Zende, for this nice, humble introduction. So respected chief patrons, course directors, Dr. Ranade and Dr. Zende. The organizing secretaries, Dr. Vaidya and Dr. Shukla, the co-organizing secretaries and the program coordinators and dear participants. So a very good morning from my side. And so today I have been invited to talk on this very important topic for the importance of conducting scientific anti-mortem examination in production of hygienic meat. So we all know that food safety is the basic criteria if we want to achieve a healthy population and healthy people. So if we talk about food safety in the aspect of food of animal origin or in the aspect of meat, so I think this is a very apt topic, that is anti-mortem examination, because it is only in the live animals that certain abnormalities, maybe abnormalities of posture, movement, behavioral abnormalities, which are actually indicating some disease, they can be detected. And once they are detected, then the efficiency of the whole process, the whole process of the slaughterhouse can be increased many times if the sick animals are shunted out during this initial screening of the post-mortem examination. So food security and food safety, they are interlinked. They go hand in hand. So where the authorities or the government is speaking about food security, at the same time, food safety also plays a very, very important role. And as we all know, it is the responsibility of everyone, the whole, the food chain from farm to the consumer, that is from the farm to the table. So everyone who is involved in this whole chain, they have the responsibility to assure that the food safety has been maintained. And if we talk about the food of animal origin, so in the food of animal origin, meat hygiene, it plays a very, very important role. So meat hygiene is having a prime role for the production of wholesome meat for upgrading the health of the community, because we all know that food of animal origin, they are packed with nutrition and they have a high biological value for strengthening of the health as well as the economy. So what is meat hygiene? It is actually a scientific concept and the procedures which are applicable to the processing of food animals in such a way that the meat and the meat products which are derived from such animals, they are safe, they are wholesome for the human and the animal use. So if we talk about the entire chain of meat production, so we can see that as per the food safety management systems, they are incorporating the hazard analysis critical control point principles in order to have food safety and assurance. So if we talk about this entire chain of food safety in the production of hygienic meat, the anti-mortem inspection plays a very pivotal role, or it plays the prime role, or I would say it is a first line of defense to segregate the animals into unsafe or safe, or otherwise we can say low risk and high risk animals. So accordingly, the animals, they are processed, and accordingly we take care that only the meat which is from the low risk animal, that only enters in the food chain, and ultimately it will help in maintaining the hygienic meat quality as well as the production of healthy meat. So if we talk about meat hygiene, there are three principles of meat hygiene. Prevention, that is, we can prevent the microbial contamination by adopting some proper GMP practices, or by certain intervention strategies. Then the second principle is to minimize the microbial contamination in the food product. So we can use the preservation techniques, that is low temperature preservation, to minimize the microbial load. And the third principle is to reduce or eliminate the risk of microbial contamination. So reduction can be again done by using suitable preservative techniques, like by using radiations or by using heat treatment, and elimination can be done by certain packaging systems like aseptic packaging or other type of packaging systems. So all these things, they can be taken care of only by proper meat inspection. So what is meat inspection? So means we are inspecting the meat, or we are inspecting the meat animals, so that only the healthy and normal and safe sound meat animals, they are passed for slaughter to enter into the food chain. So such animals, they should be presenting no risk for the consumer, as well as they should not be presenting any risk for the establishment or the facility where they will be being processed, as well as they should present no occupational hazard for the slaughterhouse facility personnel who are handling that type of animal. So what is meat inspection? It is the expert supervision of the whole process of producing the meat products with the objective of producing wholesome meat for human consumption to prevent any danger to the human health, the ultimate consumers, or the people who are involved in that particular chain. So broadly speaking, this meat inspection, it comprises of three very important components: anti-mortem inspection, which we will discuss today in detail, that is examination of animals prior to death or prior to slaughter to assess their suitability as a source of products which are fit for human consumption. The second is the post-mortem examination, which is the examination of the carcass and the organs after their slaughter to assess whether these products, they are fit for human consumption. And the third important component is hygiene and slaughter inspection, that is to inspect all the facilities of the slaughterhouse, the equipment, all the processes which are being carried out in that facility to assess whether the entire production system is working hygienically or not. So these are the three very important components of meat inspection. So we will be concentrating on the first component today, that is anti-mortem inspection. So prior to doing the anti-mortem inspection, it is a duty of the officiating veterinarian or the para-veterinary staff to assess whether everything is being handled carefully and in a very humane and ethical manner, so as the animal welfare is safeguarded. So if the animal welfare is safeguarded, everything is being carried in a humane manner, only then we can say that the meat quality will also be to the desired optimum quality level. So we need to assess whether the animals, they have been transported according to the rules and the regulations, whether they were the proper hygienic or the minimum hygienic standards they were followed in the course of their transit. So coming over to the introduction of anti-mortem examination. So we all know anti-mortem means before death. So it is the inspection of live animals or the live birds. So live animals and live birds, they are inspected prior to being slaughtered, and that is called anti-mortem examination, with the aim that only clean, healthy, and chemical residue, antibiotic residue, and stress-free animals, they are presented for slaughter. So who performs the anti-mortem examination? It is performed by the qualified veterinary doctor or food safety inspector or the meat inspector, but under the veterinary supervision. That is under the supervision of a qualified veterinarian. So broadly speaking, the veterinarian has to first observe the animals randomly while they are being unloaded in the slaughterhouse. Then initial checks will be done by the official veterinarian assisted by the paraveterinary staff, followed by the proper anti-mortem inspection, which will be done at least 24 hours, only 24 hours before the actual slaughter. And then completion of all the records, the documentation, and finally the enforcement of the anti-mortem examination. That is, the animals, they have to be deemed passed fit for slaughter by the veterinarian. So there are three important concerns. That is public health concern, that is the concern to prevent any zoonotic disease to enter into the food chain, as well as to prevent the occupational hazards. The animal health concern, that is to prevent the entry of any, animal suffering from contagious disease into the whole lot. And the animal welfare concern, that is everything has to be done ethically as per the rules and regulations and in a very humane manner. So objectives of anti-mortem inspection include to screen all the animals, of course, which are being destined for slaughter, so as to ensure that only healthy, safe animals, they are being passed fit for the slaughter, as well as to identify any reportable animal disease to the higher authorities. So it is a screening process to remove the sick from the unsick birds. We have to ensure that all the animals, they have been rested properly. They have been rested adequately prior to the anti-mortem examination, prior to the slaughter, and to ensure that the animals which are in some pain or suffering, they should receive emergency slaughter so that they can also be treated humanely. So means it is the first line of defense in protecting people from potentially harmful meat products. So then there are some diseases, the identification of which is possible only during the anti-mortem examination. And if this anti-mortem examination has been done in a careful and a qualified way, then it will make the post-mortem examination more less laborious and more efficient. So if we speak about the procedures for anti-mortem examination, so it is identification of the animal and to collect all the details regarding the animal. Then this animal has to be inspected both ways. While the animal is at rest, that is collectively all the animals can be observed in the lairage while they are in rest, and then individually all animals, they can be observed while they are in motion, both unilaterally, that is from one side, or bilaterally, that is the animal can be observed from both the sides while the animal is in motion. And it is the duty of the food business operator, that is the management of the abattoir, to present all the animals. So it is mandatory that all the animals who are going for slaughter must receive anti-mortem examination or anti-mortem inspection. So it is done in lairage within 24 hours of slaughter, and if by chance the slaughter is being delayed, then it has to be repeated. So the important facilities which are required during anti-mortem examination is a lairage, that is a resting place for the animal, which has different type of pens. So the pens, it should be ensured that all the pens, the driveways, they are having proper flooring. It should be non-slippery. There should not be any sharp object to prevent injury to the animal, and there should be proper footing for the animal. Then the pens, especially the isolation pens, the suspect and the condemned pens, where the animals which are, arising some sort of suspicion health-wise, they are kept. So they should have proper lighting so as to properly examine the animals. Then there should be a crush or there should be a squeeze to restrain the animal. So proper restraining facility should be also there in for the animals which have to be closely observed, or for the animals whose temperature has to be taken. Then supporting staff is very, very important. So there should be adequate, competent employees to move the animals, segregate, restrain, identify, and dispose of the animals. And it is a duty of the veterinarian to closely monitor the support staff just to ensure that they use humane animal handling practices all the time. Then miscellaneous facilities like the thermometer, the tags, to tag the animal, the suspect animal, the condemned animal, the pliers, etc. They are all required for anti-mortem examination. So it is carried out in lairage. Both sides of the animals, they are examined. Collectively, all the animals can be examined, followed by individually at rest as well as in motion. So if we talk about the poultry birds, so the poultry birds, the anti-mortem inspection is done in coops only. And it is done in the holding yard or the resting area at the unloading point. And it has to be ensured that this holding yard is having sufficient light for the proper anti-mortem examination. And it is protected from extremes of temperature, since the poultry birds, they are very prone to the heat stress. And it is properly ventilated and it is adequate in size. And the poultry birds, they are inspected on the day of slaughter, and they are inspected on a lot or on a group basis, while they are still in the coops before or after removal from the vehicle. So what is a lot? Lot actually is made up of the birds which are coming from a single house of the poultry grown on a particular farm. So that is called a lot. So lot basis, they are examined. And if there is some suspicion arising, then you can remove some coops from some sample coops from the lots for a more detailed physical examination for the evidence of any sickness or any type of disease. So the overall condition of the birds, their head, eyes, legs, and the entire body, the body condition, everything has to be examined. And in case of any doubt or suspicion or disease, then the entire lot is put under the examination, and the birds which are sick or diseased, they are then condemned. So that is how the poultry has to be inspected. So once the coops have been inspected, then the unloading is done, and throwing of coops is not allowed. In order to carry out everything in a hygienic manner, the birds, they are handled with care. They are hanged on the shackle of the processing line, providing to avoid any stress to the birds by doing so in a dimly lit room, and to avoid any flapping or fluttering of the poultry birds, in order to avoid any undue fracture of the wings or maybe hemorrhages, etc. So as to improve the overall quality of the meat, and to ensure that all birds which are proceeding for slaughter, they are stress-free. So how to inspect the poultry? So inspection of the, livestock. So inspection of the livestock has to be done by observing all the animals at rest, and secondly, observing all the animals while they are moving. So while it is very important to inspect both at rest and motion, because there are some abnormal signs. Say, for example, labored breathing, which is detected nicely when the animal is at rest, while there are certain abnormalities, say lameness, which is detected properly while the animal is in motion. So it is a veterinarian to decide and determine that in motion, the inspection has to be done from both sides to determine that whether the animal is eligible for regular slaughter. So when the veterinarian is performing at rest inspection of the animals, he has to position himself at various locations outside the pen and observe the animals and note down their general behavior while they are at rest. And we have to determine if any animal is showing any abnormal behavioral patterns, such as excitability or severe depression, by observing the animal very closely. And while we are observing the animal in motion, then we can position ourselves outside the pen at such a place where we can easily view the whole body of the animal while the animal is being driven by the associated staff. So we can view the head of the animal, the neck of the animal, the shoulder, flanks, the legs, and the rump. But once we are positioning ourselves outside the pen, the safety should be the topmost priority. We have to position ourselves at a safer place where like, for example, some animals, they are very agile, or they are quite excitable. So once the animals are being driven out by the staff, they could push us against the swinging gate and crush us against that swinging gate. So all those things should be taken care of. We should not position ourselves in some corner or you can say in a place which allows no escape if the animal turns hostile or if the animal turns excitable. And also taken care that never enter the pen of the animals which are polled animals or the horned animals or the cows which are in estrus or the bulls or the cows which are accompanied by calves, since they tend to get more excitable or they tend to get startled once we are going in their vicinity. So the veterinarian or the examining staff must at all times wear helmets, the safety aprons, the gumboots, and other safety equipment. So there is one more criteria or a procedure which is done for the large establishments, especially the ones which are handling the pigs and the lambs. So that is called voluntary segregation, which is a procedure used to describe the inspection that takes place when the establishment voluntarily segregates the animals prior to anti-mortem inspection. So in this voluntary segregation, we have to examine all the animals which are segregated by the establishment, which have been found normal by the slaughterhouse establishment while the animals at rest. Then from those animals, select 5 to 10% of the animals and observe them in motion. For motion, you can select 5 to 10% of the animals, and then you can instruct the establishment to move all the abnormal animals into separate suspect pens, and their final decision will be taken by the public health veterinarian. And once the establishment is observing this voluntary segregation procedure, we can randomly observe them doing so at least once in a month to see if it is being done properly. Then there is another concept that is called delayed slaughter, which can be done for the low volume establishments. That is, the anti-mortem inspection can be done a day before the scheduled day of the slaughter, particularly for the low volume establishments. And it can also be done for the animals who are exhausted or who are exerted during their stress. That is, the ones which are having travel stress, in order to give proper rest to those animals or the animals which are suffering from some sort of transit fever. Then a very important concept is the emergency slaughter. So emergency slaughter is allowed. It's a special provision, and it is allowed for those animals which are in acute pain or they are suffering from a condition where any delay in the slaughter will be contrary to the animal welfare. So to relieve the animal of its pains or suffering, the slaughter is done at the farm only. So that is called the emergency slaughter. So it can be done on the farm. So probably the animals who are recumbent, going to some limb fracture, or they are in pain due to some severe injury, or they are having some functional physiological disorder. So they can be humanely slaughtered on the farm to save them from further pain and suffering. So that is the emergency slaughter. But there are certain rules for the emergency slaughter, and there are certain declarations which the farmer and the veterinarian has to give along with the emergency slaughter when the carcass will be transported to the slaughterhouse establishment. So these animals, they are slaughtered, but one very important thing about emergency slaughter is that it is not intended to cover the slaughter of the sick or the dying animals. Only the animals which are seriously injured can go for emergency slaughter. The body of the animal has not been dressed, and once this slaughter has taken place, the animal should be bled and it should be hygienically transported within 2 hours of the slaughterhouse facility. If it is not possible, it should be chilled at the and if any viscera has been removed, that should accompany the slaughtered animal, and that viscera should undergo careful post-mortem examination. So while the animal is being received at the slaughterhouse, the emergency slaughtered animal, it has to accompany with 2 declarations. First is the declaration by the farmer stating the identity of the animal and any veterinary products or treatments administered to the animal along with the date of administration and its withdrawal period. And second is the declaration by the veterinarian, which will record the favorable outcome of the anti-mortem inspection, that it has been done and it is favorable, the date, time, and reason of any treatment which had been administered to the animal by the veterinarian. So these 2 declarations should accompany the animal who has been on farm emergency slaughtered. Then one more concept is the casualty slaughter. So this is different from the emergency slaughter. Here the animal is not in pain, or it is not in suffering, or it is not in the immediate danger of death. But it is affected with some more chronic conditions like obturator paralysis or postpartum paraplegia or some sort of tumors. But this does not render the meat unsuitable for human consumption. So all these animals, they come under the category of casualty slaughter. So the veterinarian decides whether this animal is suitable for transport to the nearby slaughterhouse. And this animal must go anti-mortem inspection, and it is slaughtered immediately on arrival. So apart from this, there are some outcomes, mandatory outcomes of anti-mortem examination, or you can say decisions or the anti-mortem disposition. So any of these three anti-mortem outcome has to be decided by the qualified veterinary doctor or the officiating veterinarian of the slaughterhouse facility. So it could be either fit for slaughter, that is the animal or the lot of birds, they are passed for slaughter, that is they are fit for consumption as human food. The second category is suspect or detained. So these are those animals or birds which exhibit some signs of disease or condition and arouse a factor of suspicion, and further confirmation during careful post-mortem examination is needed before either passing the animal or condemning the carcass or a part of the carcass. And the third anti-mortem disposition is suspect or detained. So these are those animals which are clearly found not fit for human consumption, and they must be destroyed and they must not be allowed to enter the food chain. Okay, so first is passed for slaughter. So the animals free for the disease and conditions, they are deemed fit for human food. Therefore, they are passed or they are released for slaughter. And this has to be certified by the officiating veterinarian on the pen cards or on the drive sheets or on the performa, which is being used by the veterinarian. The second category is suspect. So the animals which exhibit abnormal signs that create a suspicion that the animal is affected by a disease, they come into this category. So they could be the animals which are seriously crippled, or they could be the animals which are showing some signs of disease, fatigue or stress. So those animals, they are detained and they are allowed to take rest for around 24 hours, and then they are re-examined for anti-mortem inspection by the veterinarian. So those animals which are suspect, they are set apart in separate pens. They are also slaughtered separately. And further, after careful examination, the veterinarian can decide on these animals. So there could be 3 or 4 possibilities for the animals falling under the category of suspect animals. The first is that after further examination of an animal in the suspect pen, the veterinarian may determine that the animal is not fit for human food according to the regulations and it must be condemned. Alternatively, he may decide that the suspect animal is normal, or the abnormal signs which were observed, they are not severe enough and the animal can be released or passed for slaughter. The third possibility is that the animal can be continued to slaughter separately, making final disposition during careful post-mortem examination. And the fourth possibility, that is a rare occasion, can be where the establishment may request and receive permission to withhold the animal on the premises itself for the treatment in order to improve the condition of the animal to the point that it becomes eligible for slaughter. So this is called on-premises treatment, and such animal, the record of such animal is maintained on a separate pen card. And after following the treatment, the veterinarian may again examine the animal, make the anti-mortem disposition, and may decide whether to condemn the animal or release the animal for slaughter. So these are the 4 type of decisions which can be taken by the veterinarian for the suspect animals. The next outcome is condemnation. So the animal which is not fit for slaughter, that is condemned because it has been identified by having some disease which makes it unfit for consumption by human beings. So all dead, dying, disabled, diseased livestock suffering from some contagious disease, or the animals which are dead in pens or dead on arrival, highly emaciated animals, suffering from some communicable disease, animals like rabid animals, anthrax, blackwater, FMD, swine fever, tetanus, caseous lymphadenitis, white spore. So all these animals or all these diseases which cannot be treated, they are contagious, they are all categorized into the condemned category. So they are disposed of. The establishment must promptly and humanely dispose of or kill the animals. So either on-premises rendering can be done, but the establishments which do not have their own disposal facilities or equipments, they can send it to some other place, and that is called off-premises disposal. So as per the regulatory requirements, the condemned products can be destroyed in the presence of an inspector by incineration or chemical denaturation, or by using any other material which has been approved in the regulations. So another very important thing is to maintain an anti-mortem inspection card, which can bear all these details listed here. And this is the type of anti-mortem inspection card, which is being used by the US DA, the Food Safety and Inspection Service. So the card is divided into two parts. One is the anti-mortem and second is the post-mortem report. So the upper section, it contains information like the slaughter establishment number, whether the animal is condemned or suspected, along with the tag number of the animal, the species, breed, sex of the animal, tagged for any condition which you might have observed, like maybe it is pneumonia, tuberculosis, brucellosis, or some fracture, etc. The temperature in degree Fahrenheit, the weight in pounds, and the remarks of the veterinarian. And the lower one portion, it is the post-mortem report, where the findings of the post-mortem examination, they can be recorded, and the final disposition can be maintained by the inspector along with the signatures and the date. So this is the performa for anti-mortem fitness certificate, which has to be followed by the slaughterhouses registered with FSSAI, and it has to be issued by the veterinary doctor. So here the opinion of the anti-mortem examination is based on the species, breed, sex, body color, pregnancy, approximate age, gait, posture, temperature, pulse rate, appetite, eyes, nostrils, muzzle, etc. And the final opinion is done. So this one form is for 12 animals, and finally it is certified by the qualified veterinary doctor. So this is the performa for anti-mortem examination for the birds. So here all the findings of the birds that has to be noted down, especially if the veterinarian is observing any clinical symptoms for salmonellosis or ornithosis, because such birds, they can contaminate the entire facility or the chain. So, and the final disposition, whether it is approved for slaughter, postponed, or slaughtered at the end of the whole chain or after the normal birds have been slaughtered, that is being recorded. So the FSSI mandates the inspecting animals at the slaughterhouses for certificates, and the provisions for anti-mortem and post-mortem inspection, they have been scheduled or specified in the Schedule 4, Part 4 of the FSS Regulations 2011. Now, quickly going over to the procedure of anti-mortem examination in detail. So there are two stages of examination. One is general examination, where the general behavior, reflexes of the animal, gait, posture, any abnormal body movement, condition, or the signs on the body surface, they are being observed by the veterinarian. And if some suspicion arises, then the veterinarian can conduct detailed examination, the temperature, pulse, respirator, or any other tests, or the blood smears if you want to conduct. So these are the general signs or abnormalities which can be observed. So a little bit going into detail. So when, the first thing is to record the normal body movement of the animal. So in this case, the veterinarian, he has to see while in motion whether the animal is lame or limping, then record any sort of stiffness or pain in the animal because of arthritis. Then any sort of central nervous system disease, because there are certain diseases like rabies, listeriosis, which affect the central nervous system, and the animal may, appear extremely restless, nervous, anxious, or show some staggering type of movements. Then there are certain poisons or toxic residues which the animal has been exposed to, which can also lead to abnormal body movement. It can lead to staggering gait of the animal. Then depression or disinterest of the animal could be a sign that the animal is dying or it's in a moribund state, and such animals will not respond to any external noise or any other type of stimuli, and such animals, they are not eligible for slaughter. Then the animals could be depressed, or they again may fail to respond to any stimuli if they are under the influence of some sort of tranquilizer. So the tranquilized animals, they are also not eligible for slaughter because such drugs have a specific withdrawal period that must elapse before the animal is eligible for slaughter. Then the animal may be disoriented, it may run into, or it may push its head against the objects, it may scratch excessively because of the presence of any, skin disease, scabies, or lice infestation. Then the animal may have some sort of muscle tremor or shivering. So all these things, they indicate the abnormal body movement of the animal, which can be noticeable only in the anti-mortem inspection. So there may be some abnormal gaits which could be associated with some sort of diseases or sickness, which will deem that the animal is not fit for slaughter. Like a wobbling gait can indicate septicemic disease, walking in circles can indicate listeriosis, stiff gait can indicate traumatic pericarditis. Then animals, they may strain and they may assume some abnormal body positions, which may indicate that there is some sort of urinary or intestinal disorder, which is causing the straining of the animal. There may be arching of the back of the animal, or there may be the tucked abdomen of the animal, or there may be extending of the back or the tail of the animal. Then there may be some downer animals or the non-ambulatory or the recombinant animals which are not in a position to walk, either due to some fractures, broken appendages, or the fracture of the vertebral column, or due to some sort of metabolic conditions. And it is a duty of the veterinarian to, examine the conduct anti-mortem examination of such animals at the place where they are lying in order to avoid any type of injury, further injury or suffering to the animal. So these are some sort of, pictorial representations of the abnormal posture. So it can indicate milk fever, frog-like posture. It can indicate obturator paralysis or bilateral dysplasia. Kicking at the belly, the animal may exhibit such symptoms when the animal is in acute pain. Then the animals at post-mortem examination, they can also, the veterinarian can also has to observe the body condition also. So there could be some signs which indicate that the animal is exhibiting abnormal body condition, which are indicating some sort of sickness or some sort of disease. For example, the animal may be emaciated. So here we have to differentiate the animal which is normally thin. For example, some aged cows, they can be normally lean. Or some calves which are immature, they can also be lean. And we have to differentiate the lean animals which are physiologically lean from the animals which are lean due to some underlying problem or due to some underlying chronic disease such as pericarditis, pneumonia, nephritis. So such animals, they are in a poor condition and they exhibit some other signs also. For example, they may exhibit lethargy, depression. We can take the temperature of that animal. Then there are abnormal signs like respiratory distress, which indicate some sort of respiratory disease. The animal may be showing labored or rapid breathing. There could be some signs like coughing, sneezing, or some signs which are associated with lung pneumonia. Then we can also encounter some animals which are in the act of parturition, and the regulations prohibit the slaughter of such animals for human food until they have given birth and also passed the placenta. Then there could be the animals, some animals which are exhibiting signs of pain due to some underlying disease. And these pain signs can be manifested by grunting, groaning, or the grinding of teeth by the animal. So the abnormalities for respiration can be observed by observing the animal at the flank region. So breathing pattern can be seen, and if possible, the breathing rate can be measured by restraining the animal. Then if abnormal respiration is found in pig, then the whole lot can be treated with suspicion. Then abnormalities in structure, which will also be evident only on anti-mortem inspection. There could be some abnormal growths, swellings, enlargements, or hernias. Then three very common conditions we can see at anti-mortem examination depicting abnormalities. For example, the lumpy jaw and actinomycosis, which actually involves the bony structure of the head, particularly the mandible. Then there is actinobacillosis, which involves the soft tissues of the head, especially the tongue, that is called wooden tongue. The epithelioma, which is a new plastic condition, which is involving the eye, eyelids, and the orbital region. So all these, they can be observed during the examination. Then abnormalities of the skin, mucous membrane, they can all be observed during anti-mortem examination. So there could be some papillomas, ulcers, sores, vesicles, which may indicate some underlying disease like foot and mouth disease or some other type of reportable disease. So all these have to be carefully observed. Then some abnormal swelling. If there is abnormal swelling in the neck or the round region, that can indicate that the animal has been injected with some drug. So all the drugs have some specific, or the approved drugs have some specific withdrawal period prior to the slaughter, and that withdrawal period should be observed. Otherwise, it will result in potentially harmful residues, accumulation of such residues in muscular tissue, which are harmful for consumption in the meat. So such animals should be treated as suspect so that the further test could be performed if these residues are present in the tissues, and sufficient time should be given for the withdrawal period to elapse to make such animals eligible for slaughter. Then there could be some enlargement in joints or there could be hardness in the udder, etc. And all these conditions can be detected in anti-mortem examination. So this is the abnormal appearance or the coat of a lamb. Then the abnormal colors, for example, red areas on lightly colored skin can indicate inflammation, which can be an indication of some sickness. Dark areas can indicate gangrene. And then abnormal discharges can also be observed, or abnormal protrusions from the body. So abnormal discharges can include maybe excessive salivation, diarrhea, bloody discharges, pus, etc. Or the animals which are having a retained placenta, they can also be included in this group. Animals with the prolapsed uterus, they have an abnormal discharge as well as abnormal odor. So all these things should be observed carefully. Then there could be some abnormal odors which can indicate some presence of some pathological condition like medicinal odor, which can indicate the breath abscess. Then stinkweed odor or acetone type of odor indicative of ketosis, and putrefactive odor, putrid bronchitis. So these are the normal. Then it is very important to observe if the animal is showing any signs which indicate that the animal may have some abnormal temperature. So it is always advisable. So if any cattle, sheep and horse, they are having temperatures above 105 degree Fahrenheit, those animals are likely to be condemned. And it is 106 degree in case of swine. So no animal in a febrile condition shall be permitted for slaughter. That is very important. So these are quickly going through some of the diseases which are commonly observed during anti-mortem inspection, along with their salient signs as well as their judgment. So as I previously told you, that the animals which are emaciated, which is very clearly visible by seeing their body, they are deemed unfit for slaughter. The rabid animals who are depicting either the signs of restlessness, excitability, or aggressiveness, they are unfit for slaughter, they have to be destroyed. Then anthrax, which is a condition, serious condition, contagious disease, which is manifested by high fever and bloody diarrhea and terry dark blood coming out of the natural openings. So such animals, they are unfit for slaughter. Animals showing fever, vesicles filled with clear fluid on the mucous membrane, so they are indicative of foot and mouth disease, unfit for slaughter. Then the animals with chronic granulomatous disease diagnosed as lumpy jaw, that is actinomycosis, and wooden tongue, they are in the suspect category. So if there are some localized conditions, then you can always put the animal under suspect category on anti-mortem inspection, with the condition that a detailed and careful post-mortem examination will be conducted for such animals, and part of the carcass can be condemned during the post-mortem examination. Then if there is swelling on the shoulder, neck, breast, loins, or thigh, and the lesions are indicative of black water, then the animal is unfit for slaughter. Tetanus, again it is unfit for slaughter.
All the participants are requested to just mute your mic. Don't talk in between.
If the animal is and then again it is in suspect category. So if it is chronic
Hello?
mastitis,
All the participants are requested to please mute yourself.
हमें पूरा वहाँ भेजा आज जान मत
Sir, you can mute them. You can mute them.
Dr. Jhende, please remove him.
शाबाश मेरे दोनों साल आवड़ा
Dr. Jhende, please remove him.
Yes, sir, yes, yes. Okay,
So,
okay.
in case of mastitis condition, if it is chronic mastitis, the animal can be always, put under suspect condition. If it is chronic mastitis, then that part can be condemned on post-mortem examination. But if it is acute mastitis, and if there is no fever, and if there is fever, acute mastitis, as well as if the animal, the condition they are depicting that the animal is in some septicemic condition, then of course the animal will be not passed fit for slaughter. In case of tuberculosis, listeriosis, of course, the animal is deemed unfit for slaughter. In case of jaundice disease, the animal may appear as a bag. It is a very hidebound type of condition. The animal appears as a bag of bones, and the hindquarter is always stained with watery, foul-smelling feces containing gas bubbles. So in such cases, that is in case of jaundice disease, the animal is deemed unfit for slaughter. It is condemned. Now, in case of caseous lymphadenitis, which is mostly seen in sheep, so there are enlarged superficial lymph nodes. So if it is a generalized condition, the animal is condemned for slaughter. But if it is localized, then it is put under the suspect category with the decision to have a more careful post-mortem examination for such animal. Hemorrhagic septicemia, an acute condition, the animal is condemned for slaughter. So quickly going to the species-wise judgment of anti-mortem inspection. So the cattle, they are put in suspect category if they are suffering from localized conditions like actinobacillosis, actinomycosis, mastitis, ringworm, and mange. But if they're suffering from some contagious diseases, as well as fluorine and selenium poisoning, then they are deemed unfit for slaughter. Likewise, in case of sheep, if it is localized caseous lymphadenitis, they are placed under the suspect category on anti-mortem inspection. But if it is a generalized one, along with other contagious conditions, then the sheep, like in sheep scab, FMD, GID, enterotoxemia, they are condemned for slaughter. In case of pigs also, like if the pigs, they are suffering from acute erysipelas condition or atrophic rhinitis, edema, actinomycosis, then they are under suspect condition. And if they are suffering from hog cholera, rabies, salmonella, they are condemned. So likewise, poultry also, if they are suffering from conditions like ornithosis, ranicate, infectious bronchitis, laryngotracheitis, coryza, coccidiosis, they are condemned for slaughter. And especially the birds who show signs of salmonellosis, they can be condemned or they could be put under suspect category with the condition to slaughter such birds only and only after the whole normal slaughter has been carried. So the poultry birds have to be observed for all these normal signs through observations of their full body. So the prominent signs which have to be observed for are for any swelling around the eyes and the head, edema, cyanosis, or hemorrhages of the petals, which may be indicative of some serious contagious disease, for any sign of gasping, sneezing, diarrhea, skin lesions, torticollis, bone or joint enlargement, dermatitis, and emaciation. So for poultry birds also, there are again 3 types of anti-mortem dispositions. That is fit for slaughter, that is the birds which are healthy, active, bright, they can be passed fit for slaughter. And those birds which are showing some disease signs or any condition that would cause condemnation of the carcass on post-mortem inspection, they are condemned on anti-mortem inspection. So these birds, they are not dressed and they are not conveyed into any part of the establishment where the normal poultry or they are being prepared or they are being held. And such birds must be disposed of appropriately by the designated methods, which may include either tanking, incineration, or denaturation. Then those birds that do not plainly show, but they are suspected of being affected by a disease which would cause the condemnation of carcass, they are grouped under the suspect category. And again, we can, the veterinarian can decide how to handle these suspect birds. So either they can be slaughtered separately if their further handling does not create a health hazard, or they could be released for treatment, or if the treatment is not practicable, such birds can be condemned. So then there is this is my last slide. So the animals which are used for research, they are also normally not allowed for slaughter, because the animals which are involved in experiments involving biological products, drugs or chemicals, their slaughter is prohibited. So such animals, the regulations prohibit the slaughter of such livestock which have been used in the experiments, and they should be condemned, they should be withdrawn from the slaughter till the residues are excreted or they are metabolized by the body to harmless end products. So any animals that have been subjected to additives or pesticide chemicals must demonstrate compliance with the FDA tolerance levels. So only then they could be allowed for slaughter. So that is all about my presentation. So I hope I was able to complete in the designated time. So thank you everyone for the patient listening. Thank you so much.
Okay, thank you, Dr. Simran, for nicely presented all the requirements of the anti-mortem of food animals and also the birds, that is poultry, which is mainly slaughtered for the human food. You have covered all the aspects of the anti-mortem, how it can be done for the live animals and the live birds to select these healthy birds and the animals for the humans slaughter. So I just invite the 2 or 3 questions, or we can also have this chat box questions also to Dr. Simran.
Good morning, ma'am. Ma'am, one question is there from one of the participant. So he's asking if he is suspecting icteric conjunctiva and mucosa. So whether the animal should be passed for slaughter or it should be kept.
Icteric conjunctiva or mucosa, that is indicative of many pathological conditions. For example, it could be leptospirosis or it could be other conditions. So in such case, again, it is the veterinarian who has to see if possible he can also do some type of laboratory test, delay the animal for slaughter or put it under suspect category and make more examinations.
Then one more question is asked from one of the participants. So he's asking that anti-mortem inspection is under OPRP or CCP.
I can't make out. Can you please repeat?
He's asking whether anti-mortem inspection is under OPRP or CCP.
I think that one is OPRP.
As per ASAP he is asking. Okay, that's the anti-mortem point is either it is your CCP point or OPRP point.
Actually, we have decided that one OPRP in our company, Sneha Farms Private Limited.
Yeah, it is a CCP. I can answer that. It is,
it is not CCP, point, it is OPRP.
Yeah.
It is not that much. It is, we decided OPRP in our company.
Why you decided?
That is, actually we have done 10% of lot in anti-mortem. So post-mortem we have done 100%. So we decided post-mortem, CCP, anti-mortem and OPRP.
And what about suppose if the animal itself? Animal itself, it is in raw material, to the any slaughterhouses. So if you select any raw material, either it is of slaughterhouses or any vegetable or the plant origin food processing plant. So whatever it is raw material is there, it is also considered as a CCP. Okay, critical control point where you can control the contamination itself. Okay, if you get a healthy animal, definitely you will get a good of the hygienic meat. If you get diseased animal and you are slaughtered, you will get bad quality meat. Okay, so CCP, it is defined as a critical control point wherein you can control the contamination. So either it is eliminating 100% or it is reducing to the certain level. Okay, so it has to be considered as an CCP point. Simran, am I right?
Right,
Yes,
sir,
sir.
right.
For example, if we get any disease or inspected damaged birds, then we will send to rendering. So we are doing rendering. We are
No,
we are
not
we are
rendering. Not
preparing
at
field material.
antemortem. We cannot send rendering, na.
No.
Antemortem, you are
We
rejecting
no
the
no.
animal itself.
We will send. If
Huh?
we get any disease or any genetic diseases, then we will send to rendering. Definitely.
So that part now we are going to have that following lecture, okay, on the post-mortem. Okay.
Yes, yes.
That will decide. In anti-mortem, we are not sending any to the rendering. Okay. We are rejecting the animal depending upon its severity. If the animal is having, only the fever, animal maybe traveled for long distance and having a stress and having a fever. Okay, you can just isolate that animal in isolation box, keep it for some time. Okay, either it is 8 hours, 10 hours. You provide the proper rest so that animal come into the normal physiological condition, and that animal, that whatever the fever is having, that animal that might get come to the normal. So that condition is not any pathological condition because of the highest stress to the animal during transportation or walking the animal, okay, from the production point to the slaughterhouses. So that may be the reason, not a pathological. Suppose on the pathological reason some conditions are there, then we have to treat the animals in the isolation box. Once the animal is normal, then we have to offer for the slaughter. But the veterinary decides that whether that animal can be accepted or not, okay, or depending upon the what sign the animal is having. Okay.
Ma'am, Simran Fried, ma'am, I have one doubt.
Okay.
Yes,
Ma'am,
sir.
as per Animal Welfare Act, how much percent we should inspection anti-mortem?
Sir, please repeat your question.
As per Animal Welfare Act, how much percent we should inspect of anti-mortem?
How much
In
of the animals
in
can
one
be
lot.
inspected per day? You are saying like that?
Yes,
Veterinary.
poultry. I'm asking poultry, regarding poultry.
Okay.
For
Simran, you
example, we
understand
have
the
one
question?
lot. For example, we have one lot, 3,000 birds. So how much percent we should inspect of anti-mortem?
Okay, okay. Simran, do you understand the question?
Yes, sir.
Ah.
So I think it could be 10% of the animals, or some sample poops can be taken to have a detailed examination of the birds.
Yes, at present we are doing 10% in one container. And actually we are getting in lot one container around 3,000 birds. So we have done 10%.
Right, sir.
Dr. Gowda, sir, actually slaughter is subject of, state government. Either it is large animal or the small animal or the poultry. Okay. So as madam said, for the poultry, once the vehicle has been arrived at the slaughterhouses, we have to provide the rest. Okay. Actually, this vehicles in the slaughterhouses are coming in the midnight. Okay. So after 10 or 9 o'clock in the night, they start loading the birds into the vehicles, and they come and arrive at the slaughterhouses in the mid time, like in the night 2 or 3 o'clock. So till morning 9 o'clock, the animal birds are rested in the vehicle itself. They are not unloaded. Okay. So while unloading, you have to observe the birds from the distance. Okay, those birds are showing some symptoms like some discharges are there from the nostrils or like that. Their walking is not, gait is not proper. Okay, and accordingly, 10% from that vehicle we have to just isolate. Okay, and separately, and you have to see the detailed anti-mortem inspection for that birds, and from that basis you can see that how flock or how lot you have received for the slaughtering. Okay, so that you have to decide. And for the large animal, for the slaughtering in Maharashtra, we have allowed the veterinarian, they have to analyze, they have to inspect about 96 animals per day, okay, in the daylight, okay, daytime. So that is a situation in Maharashtra. Okay.
Hello. Gowda sir, please ask your question.
Yeah. See, how to decontaminate drug residues after slaughtering.
Please repeat, sir. Please repeat.
Yeah. See, how to decontaminate drug residues from the slaughtered animal.
And drug residue we cannot decontaminate. Okay, so the drug contamination is happened in animal tissues. That only we can analyze in the laboratories with highly sophisticated equipments like LCMS, HPLC. Okay, so we cannot decontaminate that. Okay, so after slaughtering only we have to select, collect the samples, send it to lab, and then we have to see the what are the antibiotics or antimicrobials are present in that as a residue in target organs like kidney, liver, or the muscle tissue. And depending upon the what are the norms given by the national and international agencies, and we have to give the decisions. Okay.
That is
At
based on the MRL.
anti-mortem level, we cannot judge the what are the antibiotic residues are there. Okay.
Okay.
Is it clear?
Yes. Okay. Thank you.
Sir, good afternoon.
Ma'am, actually, I have one doubt.
Yes.
Hello.
Yes, please.
How many hours before slaughter up we should give feed withdrawal breed? Minimum.
We should?
We should give feed withdrawal breed. How many hours before of slaughter?
We should withdraw the feed at least 12 to 18 hours before slaughter. But water should be given.
12 to?
12 to 18 hours.
Actually, present we are giving minimum 8 hours to max 12 hours, madam. Present we are giving in our plant.
Poultry birds.
Yeah. I'm asking regarding poultry birds.
8 to 12 hours is okay. And this large
Actually,
animal,
present we are giving 8 to 12 hours, but is it correct or not? I am asking that for confirmation.
Yes, it is correct.
Yeah, it's okay.
Yeah,
it's correct.
It's okay. Okay.
Yes.
Okay. Thank you, man. Thank you so much, man. Thank you so much.
Okay, thank you so much. Now we can go for the next speaker. Thank you, Simran.
Okay, thank you so much, sir.
Very nice presentation. Okay,
thank you, sir.
Now we can go for the next speaker, Dr. N.V. Kurkure sir. He is our presently Director of Research of Maharashtra Animal and Fishery Sciences University. Dr. Kurkure sir is a passionate teacher, joined the academic institutions and the nurturing hobbies of his teaching by undertaking the research in various aspects of the molecular characterization of the pathogens, molecular pathogenesis, and the development of the diagnostics. Presently, is focusing on tackling the antimicrobial resistance in the bacteria of chicken origin with exploring the phytogenetic materials and the nanotechnology. Dr. Kurkure sir is experience about 28 years in the teaching, research, and extension in the veterinary pathology. He has worked in the areas of mycotoxicosis, avian diseases, listerioses in farm animals, and cancers in the dogs, in which he has made notable contributions in the field of veterinary pathology. He is a specialist in avian disease investigations and diagnosis, making the significant contributions, and has a distinction of recording variant strains of the avian viruses circulating in the central India. Presently, in the area of their focus is tackling, as I told you, that antimicrobial resistance in the poultry. Kurkure sir is among the undergraduate and the postgraduate students, and he has guided so far about 12 master's degree program students and 1 PhD student in the discipline of veterinary pathology. He has a recipient of various awards from the various national and the international organization, and these awards includes like Young Scientist Award of the Indian Association of Veterinary Pathologists and Society for the Immunopathology, Indian Association for the Advancement of the Veterinary Research, and twice University Best Teacher Award he has received. He is also the visiting professor at the Canon National University, South Korea, for 1 year and obtained the 6-month training at Veterinary Laboratory Agency in New York, UK. He is also the reviewer of the research articles for 11 international research journals of the repute. He was the principal investigator for 5 extramural research projects. He has published so far 148 research papers in the national and international journals of their repute, 1 book, and contributed 6 chapters in the books published by CBI. And so today we have a very renowned, passionate teacher for presentation. He is going to present the topic of the post-mortem examination, the importance of the examination of the lymph nodes in meat inspection. So I invite now Dr. Kurkure sir to present his topic. Dr. Kurkure sir, please.
Thank you, Dr. Jende, for very elaborative and very good words about me in introduction. Thank you. Since yesterday there is a lot of cold here, so my voice is bit broken. Anyway, but I will try to give justice, and I hope you all will listen. First of all, I thank the organizers for giving me a chance to interact with you all people. There are more than 250 participants in this training, and thanks the organizer for giving me the chance. Actually, I'm not a public health specialist or a meat hygiene specialist. By training, I'm a veterinary pathologist. So the topic which is given, examination of lymph nodes, it suits well in my horizon. So let's go for the post-mortem examination and importance of the lymph nodes. Earlier lecture was on the anti-mortem examination, and anyway, when we do the meat inspection, actually there are certain objectives for what we would do, and why FSSI is now stressing a lot on the meat inspection. Since long we are doing, but since last decade, the FSSI is stressing a lot, and it is to check the efficacy of slaughter and carcass dressing techniques. There are in India is such a country with a lot of variations in it. There are different slaughter techniques. There are different dressing techniques implemented all over the India, and one of the one of the objective is to test the efficacy to get the maximum meat for the human consumption, and that meat should be safe. Then next objective is to prevent and detect the public health hazards, foodborne pathogens, chemicals, and contaminate in the meat. That is also one of the objectives. Most important is to provide the disease-free and wholesome meat. Wholesome word includes many things in it. Wholesome meat and no risk to human health. So that is very important objective. Apart from this, wherever the animals are slaughtered, the hidden objectives can be to monitor the certain animal diseases and verification of the compliance for the animal welfare standards. So, as in Anti-Mortem also she has narrated, but to see the animal welfare standards, to monitor the diseases, slaughterhouse is the best place where we can monitor these animal diseases and these standards. And also to early identification of the problems that may impact the public health as well as the animal health. Slaughterhouse is such a place where you can get the idea about the disease which is going to become in next week or a month. So it is a place where the animals are slaughtered, and when you collect the samples, send it for the laboratory diagnosis, you can get an idea what will be the epidemics coming or chances of the diseases. These latter two are the hidden objectives, and first three, that is providing wholesome meat, is the major objectives for the meat industry. Now my topic is limited to the lymph nodes. So in anti-mortem examinations, he has very well said the examination. He has shown good pictures also. But as my topic is limited to lymph nodes, in anti-mortem examinations also, the lymph node needs to be examined. And this is a picture where you can see there are many palpable lymph nodes, and that can be palpated. And if they are enlarged, then the veterinarian has to take a decision what to do with the animal, whether he should hold it, suspect it, or condemn it, like that. The post-mortem examination, what does it exactly means? It's a systematic examination of a dress carcass. Systematic examination. It's not hurriedly going through the carcass. It's a systematic examination, and the part of the meat to be used for the human consumption. Whatever the part of the carcass is there, which will be used as a human consumption, all needs to be systematically examined. By this examination, we may come across various lesions. So with this systematic examination, we can classify the lesions, whether it is acute or chronic, whether it is a localized or general. This thing also we can notice. Then we can coordinate the anti-mortem findings with the post-mortem findings. Anti-mortem finding can also be coordinated with the post-mortem finding. Like earlier speaker, she has told you about the cases lymphadenitis and all. I also have some pictures about it. If by anti-mortem examination may not all the time reveal the whatever is happening in the body, but post-mortem does. Post-mortem does reveal whatever is there in the meat or what is happening in the body. So the things which you missed in the anti-mortem examination may be catch hold in the post-mortem examination. So that is how we can do in the post-mortem examination. And then if suspections are there, not all diseases, they produce lesions in the lymph nodes. This is very clear. Not all the diseases. I mean to say not all. It doesn't mean that lymph node doesn't give an image. It gives, in majority of the cases, it gives a reflection whatever is happening in the body. But if it is not, and veterinarians inspecting the carcass, if he suspects, he can collect the sample and send for the diagnosis. Confirmation, if required, that can be done with this. So now coming to the lymph nodes, what are lymph nodes? Lymph nodes are basically the round masses. It's solid round masses, and it has a tissue or a connective tissue capsule around it. And where to locate it? It is always found with along with the lymph vessels. They are along with the lymph vessels, usually oval in the size, and from very small to as large as 10 centimeter or even more, depending on the disease condition, they can be of that size also. The information about size, color, and consistency gives a valuable guide. Like there was a discussion earlier going on about the lymph node. So the size of the lymph node, wherever there is an increase in the size, there is a chance of suspecting something. And when the size is reduced, maybe you can suspect there is a wasting condition, animal is not receiving feed before the slaughter for a lot of time, or maybe paralytic in that position. So the lymph nodes, they get smaller in the size in that case. So color, size, all will indicate. I have some pictures to show you about the color, consistency, and everything later on. You will have an idea about it. What is lymph? Actually, lymph is a drain from any organ or a tissue. It's a drain. And what it drains foreign antigens, antigen presenting cells which capture it, or whatever the foreign material which has been destroyed by the macrophages, that is also drained in the lymph. And if inflammation is going on, lesions means what? We decide that this part of the body is not fit for the human consumption because of some lesions. Lesion is nothing but inflammation. So whenever there is an inflammation occurring, these chemical mediators, they are also generated, they are released, they come in the lymph. So lymphatic system is a drain, and the lymph node is a trap of the drain. Lymph node is a trap of the drain. So that's why the lymphatic vessels, they are also called as the information superhighways. So if you want to screen any animal, any particular portion of that animal, it is better to screen that regional lymph node. And it is an information superhighway. So majority of the cases, whatever the inflammation going on, whatever the infection is going on, this lymph node, regional lymph node will give you an indication. If it's a localized, if it's a general, all the lymph nodes will give the same information about that. So lymph is a drain of all foreign materials, and the lymph nodes are the traps where you can, these all foreign materials, antigens, infective agents, all are trapped there, and we can get the information from them. So in lymph nodes, the particulate antigens are also filtered. I think I have also covered this. Most important is that there are meat lymph nodes. There is a certain terminology which is called as a meat lymph nodes. These are the lymph nodes of the special importance which drain the limbs from the muscle, tender skeleton, and joints. These are the parts visually used for the human consumption. And the lymph nodes which are related to these portions, they are called as the meat lymph nodes. For example, meat lymph nodes in cattle are axillary, prefemoral, ischiatic, which is you can see from the inner side only, and popliteal because it is on the legs. So all these are called as a meat lymph node. So whenever the post-mortem examinations are done, it is mandatory that the inspector at least should see these meat lymph nodes. There are lot many lymph nodes. It is not possible to go through each and every lymph node on the carcass, but at least meat lymph node should be seen, and then the carcass should be passed. If the lymph nodes reveal pathology, then the draining area or the organ for which that lymph node is meant for, that organ should be examined very carefully. It goes without saying, actually. This may be repetition or just revision for you, but whenever the lymph node has some pathology, the related organ should be examined very carefully. If the lesion notice in the tissue or corresponding lymph nodes can be removed before passing the carcass. Depending on the condition, depending on the infection, you have to remove that lymph node or remove that organ is having some lesion, and then you can pass the carcass. Depending on the condition, but if it's an anthrax, no need. The whole carcass should be condemned. So this is the structure about the lymph node. May not be very pertinent to you, but we should have an idea about it. These are the afferent lymph vessels which brings the lymph into the lymph node, and it is moving through the lymph nodes, and then again it is going to the through the lymph nodes to the efferent lymphatics, and it is poured into the blood. And when the lymph is coming from the various places, it is the foreign particles, they are trapped in the lymph vessels, mostly all the bacteria, viruses, chemicals, then inks or whatever the chemicals are there, they are all trapped here, and we can easily have an idea about that particular region. Now coming to the important lymph nodes, I told you there are very high numbers of lymph nodes, they are present in the cattle. But at least we should see the axillary, popliteal. These are very ischiatic, like this ischiatic. We must see them. Then mediastinal lymph node, mesenteric lymph nodes. These must be the popliteal, which is covering the lymph area. So those lymph nodes should be at least those meat lymph nodes should be inspected. There are a lot many lymph nodes which is not physically possible to see each and every, but whenever there is a lesion in that, you can easily identify because there is an enlargement, there are some changes in the color, you can very easily identify that there is something wrong with this lymph node, and it will catch your attention, and then you can examine it very correctly. So this is about the bovines. Now porcine. Porcine do have lymph nodes. Number is less as compared to the cattle, but at least these prepectoral, superficial inguinal, these lymph nodes, iliac lymph nodes, these lymph nodes should be examined. Very, very important to examine such lymph nodes before we pass the carcass. In sheep and goat, there are 8 lymph nodes which are very important, because in sheep and goat, literally nothing goes west. Nothing goes west except their ingesta. Probably, I don't know whether the ingesta is also used. But so at least these 8 lymph nodes are there. Parotid, mandibular, retropharyngeal, prescapular, prefemoral. All these should be examined for the sheep and goat. Now coming to, we will go with the regional lymph nodes and what does it indicate. I have classified my lecture in a such a way that the regional wise lymph nodes we can inspect, and we will have an idea of the which diseases that we can suspect it there. So in the head and neck, retropharyngeal, parotid, and submaxillary, these 3 lymph nodes are very, very important. And if you find some lesions in them, you can suspect actinomycosis, FMD, actinobacillosis, tuberculosis, or cysticercosis. So if there are some lesions, immediately the in your mind the diseases should strike these. And then there is a cervical lymph node also, superficial cervical lymph node. In particularly sheep and goat, the vertebral meat, it is also preferred. And in that cases, the superficial cervical lymph nodes are very, very important, that after slaughter, we must check the cervical lymph nodes. Then lungs, it's very, very important. In lung, there are two types of lymph nodes, that is at the junction of trachea and bronchi, tracheobronchial lymph nodes, and lymph nodes which are present in between the lungs, that is mediastinal lymph nodes. So in non-diseased animal, probably you may even not locate the tracheobronchial lymph nodes. It will, as they are not enlarged, you may not notice them. Mediastinal can be noticed, but whenever there is a disease, maybe of thoracic cavity or tuberculosis of the lung, Fascial Losses or hydatidosis, then you can see that there is enlargement of the mediastinal and tracheobronchial lymph nodes. And then actually lymph node gives the reflection of that tissue. It gives the reflection of that tissue. So once you see this lymph node, and if lymph nodes are okay, you can think that, okay, this part is okay for the consumption. Then heart, if there are certain diseases in the heart like TRP, traumatic pericarditis, traumatic pericarditis, or cysticercosis, hydatidosis, the mediastinal lymph nodes will be enlarged, and you can notice it very well. Then when we open the thoracic cavity, we have different lymph nodes, but these lymph nodes are very, very small, very, very small. And the expert eye is required to locate these lymph nodes. But whenever there is a disease condition, these lymph nodes will be enlarged, and it will come to the notice of the inspector. It will come to the notice of the inspector. So when they are enlarged and when they are noticed, the thorough examination is required. These are like thoracic aortic nodes, then intercostal nodes. All these are very minute lymph nodes are there, but whenever there is a disease, they are enlarged in the size, and we can think into it. Then there are certain lymph nodes. When we evaluate the individual organ, there are lymph nodes called hepatic lymph node or portal lymph nodes is also there. Here I have shown you some lymph nodes, hepatic lymph nodes. And whenever there is some disease condition in the liver, you will find these lymph nodes are enlarged, and there may be some lesions. Lesions we will see at the end. But there at this moment you can think that there is enlargement and there are some lesions in the lymph node, and this can give an image of the Fascial Losses, cirrhosis, actinobacillosis, physobacteriosis. These can be there. These not only 4. List is long, but important are these 4. Usually, in majority cases, you see these diseases in these when these lymph nodes are enlarged. Then esophagus, stomach, and intestine, there are mesenteric lymph nodes. Usually, these mesenteric lymph nodes are also small. They are very big in the newborn calves, newborn animal. Usually, they are not slaughtered, but they are bigger in newborn. But in adult animal, they become smaller. But whenever they are also enlarged, it gives an indication of some actinobacillosis, tuberculosis, Johne's disease, or penetrating foreign body. So wherever the lesions are there because of this disease condition, that particular lymph node will be enlarged. I have some pictures to show you, and I will show you later on about the verminous enteritis and all. Then there is near kidney there is a lymph node. It is called as a renal lymph node, but basically it is not a renal; it's a lumbar lymph node. It is a lumbar lymph node, but as it is present near the kidney, we call it as a renal lymph node. So that gives an indication about what is happening in the abdominal cavity. And if there are certain disease conditions, these renal lymph nodes will be enlarged. This is one picture of the these lymph nodes in the hindquarter and the abdomen. Again here, the lymph nodes, this mammary lymph node is important, then lateral ilia, These are also very small to observe, but whenever there is a disease condition, they will be enlarged and it will catch your attention. Then you need to examine it very thoroughly. Otherwise, they are very small and they go unnoticed. And subiliac and popliteal. This is very important because this portion is mostly consumed for the or is made for the human consumption. So it's a meat lymph node, popliteal lymph node, subiliac lymph node. They are the meat lymph nodes, so they need to be examined before the carcass is passed for the consumption. So you may miss the internal lymph nodes, which are very smaller in the size, but but these lymph nodes are mandatory to be inspected, popliteal and subiliac lymph nodes. They need to be seen. If they are okay, fine. Then spleen, usually spleen itself is a part of the lymphatic system, biggest organ of the lymphatic system. And you can find some tuberculosis, anthrax, cysticercosis, hydatidosis also in the spleen. Uterus, there are iliac lymph node near the uterus, and if there is a metritis, pyometra, tuberculosis, that can be seen. Lesions are there in the uterus, then iliac lymph node will be enlarged. It may have some pus also. If there is a metritis or pyometra, there can be pus in that. And it gives an indication if iliac lymph node is enlarged, you need to see the uterus in detail and then take a decision. Order is supramammary. These are for sheep and goat and buffaloes that you can see. And whenever there is a mastitis cases or septic mastitis or tuberculosis, you will find there is enlargement of supramammary lymph node. In case of brucellosis or arthritis, you can see the enlargement of the superficial inguinal lymph node. So these are very disease-specific lymph nodes. Those will be enlarged in those conditions. Otherwise, they will be normal. Now that was about the area-specific lymph nodes that needs to be observed and what can be suspicion out of it. Now we will come to the lymph nodes and what can be the different changes that you can find when examining the lymph node. First change that you can find in the lymph node is abscess formation. Abscess formation. These abscess can be because of the draining area has some infection, and these suppurative bacteria, they have come through the lymph, they are trapped in the lymph nodes and they produce the abscesses there. So if you see some abscess in the lymph node, you have to examine the dependent area for any infection. If subcutaneous, muscular and mammary abscessation are there, then you can suspect Acronobacter, Pyogenes, or Lingersii, these Pseudomonas, Staphylococcus, Clostridium, these can be there if you find the abscesses in the lymph node of subcutaneous and muscular. There are certain infections which can spread hematogenous. So when they spread hematogenous, you will find all over the body, the lymph nodes, they will have a lesion. And these infections are again Actinomycosis bovis, Mycobacterium bovis, Mycobacterium avium, paratuberculosis, these Pseudomonas aeruginosa, these infections are there, usually suspected. There can be other infections also, but whenever when the people see the changes in the lymph node, collect and send to the lab, majority of these organisms have been isolated from them. Then there can be, that was abscessation. Second is just inflammation. Inflammation of the lymph node, that is lymphadenitis, you can see. And this condition can be seen because of some distant inflammatory process. Inflammation is going on somewhere else, and the lymph is drained to that lymph node, and there is a lymphadenitis in this. This can be acute or chronic, caseous or granulomatosis. Caseous lymphadenitis is very common in sheep. In goat, very common in that. So that you can see. Then some lymph adenopathies are also seen in the lymph nodes, and these can be seen in the means when you cannot identify the exact cause for it, we call it as a lymphadenopathy, or certain in case of some tumors or cancer, neoplastic diseases, you can find some lymphadenopathy. There is a lymph node is having some lesions, and only by histology you could notice what kind of change it is. So those can be classified as the lymph adenopathies. Neoplasms, then squamous cell carcinoma, particularly the horn cancer, eye cancer, and from here the cancerous cells metastasize to the through lymphatics to the lymph nodes, and then retropharyngeal submaxillary lymph nodes, parotid lymph nodes, they can have the cancerous cells in them. Then lymphosarcoma, which is maybe thymic or multicentric form, maybe from mesenteric lymph nodes or something, tumor from the lymphocytes. And when lymphosarcoma is there, you will see the all lymph vessels, lymph nodes, they are enlarged and having very disturbed kind of picture. You can see irregular enlargement. In cancer, you can find any kind of shape in it. Then there is a certain condition called as a pulmonary adenomatosis or pulmonary adenocarcinomatosis in sheep. Mostly it is seen in the Telangana and southern part of the India, where the sheep are slaughtered. Where the chances of getting such lesions are common in that case. Then pigmentation, there was some discussion earlier going on. You can find some pigmentation, particularly the jaundice, icterus, or some melanosis. This pigmentation you can find, and you can see some dark brown pigment of the obstructive jaundice in the severe Fascial Losses, or whenever the jaundice is there, you can find the lymph nodes. They also take some yellowish tinge or yellowish color and the jaundice. Then very commonly found lesion in the lymph node is hemorrhages. Very, very common. Very common finding in the lymph nodes is a hemorrhage. And these hemorrhages can be because of some septicemic disease like Pasteurella multocida, or it can be an incidental hemorrhage after death. After death, as the carcass is being handled, and if the bleeding is not correct, then you can find some incidental hemorrhages in the lymph nodes. And that's after that. Then there can be some reaction to the irritant injuries in the Johne's disease, or some vaccination is given, some adjuvants are given. And when these adjuvants are processed and when they come to the lymph nodes, they can produce the granulomatous caseating lymphadenitis in them, and that can be noticed. But you need to have the histological sections for this to identify or to characterize them. But grossly, you can identify there are certain changes. Samples can be collected and sent to the laboratory for the further confirmation. Now, this is one point which is very important, that not all the diseases, they produce gross detectable abnormalities. Not all the diseases, they produce gross detections or the abnormalities in the lymph node. Particularly, I tell you, E. coli, O157, Salmonella, Campylobacter, these are the diseases which contaminate the carcass through the fecal contamination. So lymph node may be normal, but the carcass may be contaminated with these bacteria, and there in such cases the lymph nodes doesn't give a good picture. For this, you have to send the meat sample for the analysis and then examine it, and then you can pass the carcass. So laboratory examination of selected lymph nodes may be helpful to detect such contaminants. This is one table actually. Salmonella, yes, in Salmonella there can be some detectable abnormalities with the possible isolation from the lymph node. But Yersinia, Listeria, in such cases there are no gross abnormalities. Campylobacter, there are no gross abnormalities, but they can be present in the lymph node. So in such cases, if the suspicion is there, the lymph node should be collected and sent for the isolation and confirmation of this. But in fasciolate, some toxoplasma cases, you can find it match very well with the isolation with the detectable abnormalities. Now coming to some pictures which I would like to show you about the gross lesions in the lymph node. This is one picture of the parotid lymph node from the pig, and where there is a hemorrhage is there. Hemorrhage is in the sinuses, and as the hemorrhages are in the sinuses, the parotid lymph node, which has the drain from there, you will find the accumulation of the RBCs in the lymph nodes. These are the hemorrhages in the lymph node. This is one of the case of the anthracosis. Anthracosis, particularly the animals which are near the coal mines or the coal industry or where the coal is burned or something like that. The coal particles, they have been inhaled and then they are foreign material, they have been brought to the lymph nodes, and such black pigmentation you can see on the tracheobronchial lymph nodes or mediastinal lymph nodes, as majority things come from the lung or the bronchia. You can see the black coloration of these lymph nodes. These are the cases of anthracosis. Then this is a very nice case. Which pathologists always say nice. This is not a nice. This is bad. But pathologists enjoy the lesion, so the word comes nice. This is superficial lymph node of the sheep with a suppurative lymphadenitis caused by Corynebacterium. Not routinely, but in few of the cases you can see it in the sheep. This Corynebacterium is very important pathogen, and it produces caseous lymphadenitis also, and very typical lesion of the abscesses and the onion pill-like structure. You can see it here. This is Corynebacterium. Then this is also Corynebacterium pseudotuberculosis, and here you will find the suppurative lymphadenitis, and whole of the lymph node is suppurative. It's all liquefactive necrosis, and whole of the lymph node has become liquid and pus is there. Then depending on the extent of the lesion and the organs which are involved, this decision can be made whether to condemn the whole carcass or the particular portion can be condemned and then passed other portion. Now this is Mycobacterium tuberculosis, caseous lymphadenitis of the tracheobronchial lymph nodes in cattle, and you can see this tuberculosis. And tuberculosis lesions are also there. Lymph node become very hard. When you cut, the gritty sound comes, and it is a profuse, extensive enlargement of the lymph node is there. This is one of the case of the Salmonella cholera Swiss infection in the cow, and you can see some hemorrhagic spots and edematous. So lymph node is enlarged, it is edematous, having lot of juice in it, and hemorrhages are also seen. And when the lymph node was sent for the isolation, they could isolate the Salmonella cholera Swiss infection from that. Then this is the case of the tuberculosis. This is the case of mediastinal lymph node from the tuberculosis of the cow, and this is caused by Mycobacterium bovis. Nowadays, it has been also called as a Mycobacterium aureus. That also causes similar kind of lesions in the cattle. And this is tuberculosis. And see the extent of damage. It is chronic, extensive, granulomatous inflammation of the lymph node. This is again a Mycobacterium bovis, but the retropharyngeal lymph node is there, and extensive tuberculous lesions seen on the lymph node. This is mediastinal lymph node with the tuberculosis, Mycobacterium bovis, and it's a granulomatous inflammation. Here you can see the tuberculous lesions in the lung are very few, but the mediastinal lymph node has a major lesions. So this carcass needs to be condemned as it is having Mycobacterium infection. Then mesenteric lymph nodes in Jones disease in the small ruminants goat. Particularly the animals above 4 years of age or 5 years of age, there are chances of having such lesions in them. And you can find the mediastinal lymph nodes or mesenteric lymph nodes which are enlarged, and when you cut it, you can find such lesions in them. And if you do the laboratory analysis, you can isolate the Mycobacterium paratuberculosis organism from these lymph nodes. This is again lymph node from the sheep, same Corynebacterium pseudotuberculosis. And this is what you can see in the southern part of India, goat affected with caseous lymphadenitis. You can see these mesenteric lymph nodes. these are very much enlarged. Usually they are very small, but these are very much enlarged. Also, the mediastinal lymph nodes are enlarged. And typical onion ring you can see in the lesion. The way lesion is produced is very typical. And this is multiple pyogranulomatic lesions in the mesenteric lymph nodes and mediastinal lymph nodes. And you need to condemn this. This is again the same Corynebacterium. This is from pig, particularly cervical lymph node, and Streptococcus porcinus is the positive agent. And you can see multifocal lesions in the lymph nodes. And this is also abscess, multifocal abscessation. This is malignant melanoma. The tumor is somewhere on the skin, but the cervical lymph node, when it was observed, it had a black color growth, cervical lymph node. And when the histology was studied for this, they could found the melanocytes in them. Original tumor was on the skin, but somehow the animal was skipped the anti-mortem examination, and then in post-mortem examination it was been caught. Now this is one picture from the mediastinal lymph node, and these are the mediastinal lymph nodes and very much enlarged. And this is from the sheep with the bacterial and verminous enteritis. And because of the inflammation in the intestine, this intestine also you can find the worms inside. Because of this, the lymph nodes are enlarged. So as soon as you see the lymph nodes are enlarged, you have to look for the corresponding organ for any lesions. This is also same picture of the calf having enlarged mesenteric lymph nodes due to enteritis. Now this is hepatic lymph node, and the animal was suffering from hepatitis, and the hepatic lymph node was enlarged. Usually you won't find any enlargement in the hepatic lymph node, and it goes unnoticed. Goes unnoticed, but whenever there are lesions, they will be enlarged, and immediately it will draw your attention. Now this is the case of fascial losses. You see the extent of damage to the liver. It can be very visually appreciated, and see the hepatic lymph node. This hepatic lymph node is blackish. Discoloration is there of the hepatic lymph node. You need to condemn this organ. So depending on the lesions, when you see on the lymph nodes, the veterinarians doing the inspection has to take a decision whether to pass the carcass. Total condemnation needs to be done, partial condemnation needs to be done, or conditionally pass subjected to the laboratory confirmation. Like these different terms are there in the meat hygiene, those can be used, and the veterinarians inspecting do this. He has its own discretion to do this, and then he can take a decision on it. To conclude my talk, as the body lymph node drain the tissue fluids and are responsible for immunological reaction, their careful examination detects the prevailing pathological conditions in the animal. Whatever the prevailing condition is there, maybe lesions are very subtle in the organ, lesions are very subtle in the muscles, but the lymph node will have lesions, and it can direct us to carefully examine that particular portion. The lymph node inspection assures supply of disease-free, wholesome meat with no risk to human health. As I have mentioned, at least these meat lymph nodes needs to be inspected, and apart from that, if it is possible, you can see the all lymph nodes, and if there are no lesions in the lymph node, it is assured that animal is disease-free and wholesome meat can be given to the for the human consumption. The laboratory investigation of the lymph nodes help to detect the public health risk, which rarely associated with the grossly detectable abnormalities in the lymph nodes and other visceral organs, particularly the post-slaughter contamination, fecal contaminations, and when the lesions are very subtle or very confusing, the laboratory investigation helps a lot to have the public health risk analysis. These are few further readings for this very wonderful book and online resources, and Pathology of Domestic Animal by Javan Kennedy. Very nice further resources are there. If someone wants, you can visit these resources, and update yourself. Thank you. So I stop it here. I think I could give justice to the topic. If there are certain questions, I will be happy to answer.
Thank you very much, sir, for excellent presentation. In detail, you have now presented the topic on post-mortem examinations and importance of the examination of lymph nodes in meat inspection. I know you have taught us in undergraduate all the courses of pathology, and I remember that you are my best teacher in all the courses. I understood the pathology very well. So thank you so much, sir, for the excellent presentation. Now I request Jende, sir, please.
Okay, thank you, sir, for very good presentation. As from your presentation, I cannot make out you are only the pathologist, but you are also the meat of the veterinary public health person. You are also working as an in RAC team of NRC meat also. Okay, so you are well versed with what is going on in the meat industry and also the antemortem, postmortem, and how we can produce the hygienic meat for the common consumers in India and also the abroad. So thank you so much, sir. You have covered all the aspects of the how the postmortem can be done, what are the lymph nodes can be inspected for the better health of the carcass, so that we can produce hygienic and wholesome meat for the human consumption. So for the participant, I can expect one of the questions to this, sir. And also, sir, we can also read from the chat box also, and we'll put forth to you.
One question is there from one of the participants who is asking why bronchial lymph node is called as inspector's lymph node.
Yeah, good. Actually, it's a way of thinking. See, respiratory system is the system which get respiratory and intestinal system are the two systems which are more exposed to the environment, and these are the two systems where you will have the maximum lesions produced because of certain disease conditions, because they are exposed to the environment, and they are the easy access to the pathogens, respiratory system and digestive system. So whenever the respiratory system has lesions, ultimately the changes will be as lymph node, mediastinal lymph nodes and tracheobronchial lymph nodes are the traps. Whatever the lesions are there in the lung, they will be trapped in the lymph nodes. That's why in any case, the post-mortem examiner should not miss mediastinal and mesenteric lymph nodes. Because if this, then after this system, the other system comes. But these two systems are the maximally exposed to the environment, and they have ample chance of come across the pathogen.
Thank you, sir. Sir, another question is asked by one of the participants. So he just want to ask a question that what is the difference between lymph node and gland, and whether both are same or different?
Both are same. See, when the size becomes less, we call it as a node, but both are same. To be very frank, both are same. One question I could see: why cut lymph nodes after evisceration? Cutting of the lymph node is very, very essential. In one of my slides, I told you that lymph nodes are the solid organ which are covered with the connective tissue capsule. So whatever is there inside the lymph node, what changes they are happening in the cortex and medulla, they are not visible from the outside. So when you will give a cut through the lymph node, you will expose the cortex and medulla, and the lesions which are produced, that can be very well seen in that area.
Yes, sir. Thank you. And all the participants also, you should understand that sir has also already discussed and said in his topic. So whenever there is an doubt in the mind of the veterinarian, then only we have to cut the lymph node. Otherwise, no. Okay, because it is a part of the scientific conduction of the post-mortem examination. First thing is that we have to see the appearance. Okay, on visual examination that is called. You have to see the whole carcass as whether it is dressed properly or not, whether there is any spillage of the feces on the carcasses or not. Okay, so that we have to see in appearance or the visual examination. If it is okay, then you have to go for the next, that is palpation. Okay, you have to palpate the mainly the surface lymph nodes, okay, which are available in the carcasses. And in that palpation, if you find some suspension, okay, these lymph nodes, like sir already told, the prescapular lymph node or popliteal lymph node, they are very hot. Okay, they are very cold, or they are having swollen, or they are very hard in touch. Their firmness is so in that condition, if you want to check that, then only you have to cut. Because while doing postmortem also, by scientific way, the veterinarians always keep in mind that the price of the carcass. If you are going out cutting, taking multiple cuts on the carcasses, the cost of the price of the carcasses will get deteriorated, because you are disturbing the what are the different cuts are taken from that carcasses. So whenever the post-mortem is done by the veterinarians, they have to always keep in mind the price of the carcasses. And when you have a doubt in the mind, after palpation of the lymph node, then only you have to cut it. And in the palpation, once you cut it and you find something wrong in that lymph node, there is a swelling, there is congestion, okay, there is pus formation, then you have to take the sample or the impression slide, and then you can send it to the laboratories for the checking whether it is the carcass is having any infection or not. And after coming that result from the laboratory, then only you have to give your decision whether that carcasses can be passed for the human consumption or reject. Okay. So, sir, am I right, sir?
Yeah, correct.
Yeah. Okay.
Sir, one more question is there. One of the participant is asking for confirmation of jaundice suspected carcass. From which location of carcass fat has to be taken for analysis?
For jaundice fat examination, best is abdominal fat. Or subcutaneous fat will be means the fat which is in the abdomen will have earlier yellow coloration than the subcutaneous. First is the abdominal fat which has a yellow coloration, and you can see the bile derivatives in the abdominal fat first, and then it will be reflected in the subcutaneous fat.
Okay. Thank you so much, sir. I think there is no more question in the chat box. So I thank Dr. Kurkure sir for your time from your busy schedule daily. So I know that how much time you give for this training program. And also I thank Dr. Simone Pritchard for to be delivering the first topic of this today's session. So I with this thanks, I declare this today's program is over. Thank you so much. Thank you. Announcement hai? Tham.
Thank you, sir.
So all the participants, we will again for the meeting at around 50 a.m. in the morning, and 2 lectures too. And the link will be the same. So all of you are requested to join with the same link and the password. Thank you.